Hi everyone, this is the Shaken Baby Syndrome training. If you have not gotten your certificate for Shaken Baby, this presentation will qualify you as being trained. Anyone who works with children from ages 7 below need this training in order to work with children. So this is the actual training. When you are finished with this training, there's going to be an assignment that goes with it. So you need to, in this folder, that's the Shaken Baby folder, that you'll see an assignment, and that needs to be done, completed also. So let's get started. And then also you're going to need to do the work for the rest of the week. So the name of the presentation is called Babies Cry, Have a Plan. Shaken Baby Syndrome Prevention Training for Child Care Providers. This is a specific training for care providers. I am going to flip through a few of the slides. This is meant, when the training was originally started, it was people were trained in large groups, and so that's why there's some like get to know you activity kind of things. So Governor Doyle signed a bill into a bill that requires anyone who works with children, including people who are in a building with children in any capacity, to have this training. It was a unanimous bill. It was one of the only unanimous bills at the time. Shaken SBS, which I'll refer to it from now on. SBS is a medical term used to describe the injuries that can result if a baby is violently shaken. Okay, so I'm not talking like tossing baby up in the air. I'm talking violently shaken. The younger the baby, the greatest risk of harm. So any child under the age of 4 can be harmed by shaken baby, but if the baby is under 6 months old, the shaking will have the greatest risk. Violent shaking is one of the most devastating forms of child abuse. So it is considered child abuse to shake a baby. And what you can see is this baby is having its head whipped back and forth. And you can see that there's a space between the skull and the brain. And when the brain slaps on the skull, that's when a lot of the damage happens. And if you see, you can see that a lot of that in the front of the head, the brain would slap against the forehead, and then in the back, it would slap against the back, and that's where the bleeding, the hitting of the brain against the skull causes bleeding. The bleeding causes pressure on the brain, which causes a lot of brain damage. Early symptoms of shaking, the baby tends to get irritable, lethargic, having problems sleeping. Remember, a baby doesn't always die immediately from shaken baby. They can have significant impairment as time goes on, which we'll talk about in a few minutes. Feeding problems, vomiting. So if you think about a head injury, then we start seeing vomiting, dilated pupils. Then they'll have poor muscle. They could have poor muscle tone, pale or bluish skin because if there's oxygen deprivation, that their lips will start to turn blue. Seizures, so anytime there's a head injury, there's seizures, or that goes with it. Stop breathing, and then loss of consciousness. All of those are early symptoms of shaking. Other physical signs, there are a child can have rib fractures, fractures of the long bones in the arms and legs. If you think about what it would take to break a bone in an arm or your leg, one of the large bones, quite a bit of force. External wound or bruise to the head. So those are all things that can happen, but not necessarily happen. So a baby doesn't need to have a broken arm or leg or a huge wound on their head to have suffered from shaken baby syndrome. If you think that a child comes to your care and you think that this has happened, you need to call 911 immediately and begin CPR. If the child is vomiting, turn their head to make sure they don't aspirate on the vomit. Do not pick up and shake a child. So it'd be very natural to say, wake up, wake up. Do not do that. Even cause further harm. What is the result of shaken baby? So even with prompt medical attentions, many victims die. You can get care as quickly as you can, but if there's a substantial enough damage, they can still die. Those who survive can possibly have blindness. So if you remember, if you know that the occipital lobe is in the back of the head and the bleeding on the brain is happening in the back of the head, blindness is something that would be natural. Paralysis, lose their hearing, have broken bones. Okay, so then there's some other ones that are a little less obvious. So learning disabilities, a child that has learning disabilities, you wouldn't even really notice until age, through 3, 4, then you would start to see that they're having problems. So those are a little scary if a baby was shaken at 6 months. Coordination problems you wouldn't see until they started moving, trying to get around. Developmental challenges, those don't occur right away all the time, or aren't noticed right away. Seizures. The most common reason for shaking a baby is the baby wouldn't stop crying, which is extremely sad and pathetic that's why someone would shake a baby. Risk factors for being a victim. So children under the age of 4 can all be victims, but the younger the child, the more likely they are to be shaken. So under the age of 6 months, makes sense when you talk about the reason that most babies are shaken is because they wouldn't stop crying. If they're under 6 months, it's common for children to cry. Gender, boys are more likely to be shaken than girls. Not quite sure why, it's just one of the statistics. General greater demands for care, so prematurity, other special needs. Sometimes those babies cry more, so they're more likely to be shaken. Who would shake a baby? I mean, let's face it, who would shake a baby? Anyone can shake a baby, but some people who are more at risk. And this is just, some of this is logic. So parents or other caregivers, people who are responsible for babies, late teens and early 20s. And if you think about it, why would late teens be more likely to shake a baby than somebody who's maybe my age? People who are younger don't really might not think about, and not all younger people, the bigger picture, that if you do something at this moment, that it could last the baby problems for a lifetime. Also, less patience probably when you're younger. Men are more likely to shake a baby than a woman. People with other risk factors, so drug and alcohol use, huge. Mental illness, lack of self-control, inexperience with babies, and high stress. So all of those things would make you snap a lot faster. And I'm going to have this Portrait of a Promise video in this folder, so you need to stop and listen and watch that video right now, and it's labeled Portrait of a Promise. So in the video, you will have seen that there are 3 different babies who have experienced shaken baby. It's very hard to watch when you know that families have suffered, their children have suffered, and those children obviously have suffered greatly. So all babies cry. Let's face it, all babies cry. That's how they communicate. Crying is normal. Babies cry for many reasons. All babies, and that's all babies, have times where they cannot stop crying. No matter what you do, no matter how fantastic of a parent, how well you know how to take care of babies, they all have times where they can't stop crying. They're just crying, and there's nothing you can do about it. Babies cry to communicate with us, so they cry when they're hungry. A 12-year-old would say, "When's dinner? I'm starving." A 2-month-old will cry. "Discomfort, I'm not wearing those dress pants, they're too tight." A 12-year-old would say. A 2-month-old would cry. "Leave me alone." Overstimulation, a baby would cry. So think about like those babies who have tons of people coming over and holding them and passing them around. They're overstimulating them, and how they get that sensory out is crying. And so when they're overstimulated, they cry. When they're understimulated, they cry. They're sitting in a chair all day, in a bouncy chair, and not really being moved a lot, or a lot of people aren't talking to them or whatever. Again, they will cry. A 12-year-old would say, "Hey, I'm bored." Fatigue, I've had a long day. You get those babies out of bed at 6 a.m. and take them to childcare, and you go to work, and when they come home, they're tired. They cry. 12-year-old obviously would just say, "I've had a long day." How much crying is normal? So the amount of crying changes over time. And anyone who's ever worked with a baby or has babies know this, but it varies among normally developing babies. So if you look at this chart, an average baby cries at birth about an hour, a little over an hour a day. At its very crabbiest, 6 weeks is when babies peak. They cry the most, and then they start getting a little bit better. A good babies who cry less than the average are less than an hour a day, and then there's babies like my youngest son who cries 4 hours a day. All of that is considered normal crying, though. My My fourth son was the best baby and never cried. My fifth son was very difficult. Um, and they're both average kids these days. So it's absolutely normal. It gets better. You can always assure parents that even though it's hard, it doesn't mean it's not easy. I mean, that's for sure, but it will get better. So the period of purple crying is what the group that made this calls it. And purple stands for peak pattern. So you can hear it. It's the same every time. It's unpredictable. They can be fine one moment and crying the next moment. Resistant to soothing. So you can do anything that usually works, and for some reason this time it just doesn't work. Their faces look like they're in pain. They have long periods of crying, and a lot of times in the evening. What they call this crying is purple crying rather than the normal just crying throughout the different times during the day. Then you think about what is colic. Colic is a Greek term that means intestinal distress. Is something really medically wrong with the baby? Does colic mean that there's something bad, something's going to happen? It does not mean that. It is a normal condition. It's hard, but it causes gas and discomfort in their belly, and that's why they cry more. It is uncomfortable, that's for sure. Does colic simply refer to a baby that cries a lot? No. There is actually something in their intestines that makes them more sensitive. What if the baby cries a lot? Colic is extreme, but normal crying. So normal crying colic is. Crying will greatly decrease by the time the baby is 3 to 4 months old, so they grow out of it. Colicky infants show no lasting harm. Get help if the crying is a problem for you or the baby. You're not going to change the baby. The only thing you can change is yourself. So get help if you need help. It's okay. Normal doesn't mean it's easy. So it's normal crying doesn't make it easier. And there's a sweet little baby. An hour later, you've got a baby who's screaming. So at this point, what happens is there is a crying audio, and I'd like you to play the crying audio, and I would like you to time it for 3 minutes. After you listen to it, come back to this video. So the crying is to show you, I used to do this at 4C as a training, and I would play it and then watch people get either uncomfortable, irritated, embarrassed. Everyone has a different feeling for when a baby is crying. All of it is normal. They're all a normal reaction. You just have to own your reaction and know that it bothers you. How do you soothe a baby? Sorry, I don't know why this isn't doing this easier. Feed the baby slowly and burp the baby often. Gas causes pain, causes error. They get uncomfortable and they cry. Make the baby as comfortable as possible. For example, check temperature and diaper. So just make sure that their diaper is clean, that they're not too hot or cold. Provide gentle motion or relaxing sound, gently shaking and soothing a baby. Is the baby hungry, thirsty, bored, anxious, sleepy? Just do a quick check. Make sure that you understand that just because a baby is comfortable doesn't mean that they're not going to stop crying. Sometimes they just can't. So try different ways to soothe the baby. Know that a comforted baby doesn't always mean a quiet baby. Know that crying isn't always a sign that something is wrong. Sometimes they're just crying. If at any time you start feeling tense or frustrated, it is important to take a break. Most important thing, give yourself permission. When you start feeling anger and you start feeling frustrated, take the baby, put the baby in the crib, shut the door, and walk out for 3 minutes. Don't leave the building. Just go take a shower or do something so that you can calm yourself down. So, anger workout. You accept that you're angry. Okay, I'm angry. I'm tired of it. I'm going to do something. I'm going to do 20 jumping jacks. I'm going to call a friend. That energizes you, and you resume going back to the baby to make sure that they're okay. A tired, frustrated caregiver and a crying baby can be a deadly combination, leaving a parent or other caregiver to shake the baby in a moment of frustration. All it takes is a moment. Put the baby in a safe place. Shut the door. Leave them for 10 to 15 minutes. If you are calm, try to soothe the baby. If you are not calm, get help, call someone to come over and be with them. It's okay to ask for